We need a monumental shift in medicine. That is what we need. The monumental shift that we need starts with medical students. It starts with us and with medical students, and we need to model that. It's not impossible at all for us to be health-based instead of profit-based. It's not impossible at all. And in fact, all it takes is a little paradigm shift. And yes, that is difficult. But it's entirely possible. And in fact, I believe it's going to happen. Because, unfortunately, in this profit-driven world that we're in right now, in American medicine, we are bankrupting our country. And in about 20 years, on the trajectory that we're on right now, we're not going to be able to afford streets and highways. If this much cost and money gets poured into medicine, and if the trajectory, the projections that we've seen of what Medicaid and Medicare and national spending on health, if those projections are accurate, we're going to drown in over sort of inflated healthcare needs. We can easily change this, particularly as physicians, the leaders, the emblems. I mean, we are the great hope for American medicine. And physicians need to stand up. It's so important that we stand up and actually say that money will not drive us, but health will. Pharmaceutical corporations, are they evil? Are these human beings evil? No, they're not evil human beings. They have a job to do. The job of a pharmaceutical corporation is to make profit. If they don't make profits, their shareholders pull money out and they deflate. They cease to exist if they cannot generate profit. That's their job. They have to make profit. It's okay to try and make profit. They should do that. The problem with pharmaceutical companies and medicine is that we in medicine, physicians particularly, but experts, policymakers, patients, everybody, we have allowed their job, profit, to affect the way we do our job, healthcare. I would say this, the most important thing that a physician does is to take on cultural responsibility of their profession. It's the most important thing that we do on a daily basis, is to believe in what we do. And if we allow a desire for money, a desire for riches, a desire for status, if we allow those things to contaminate us, to get in between us and our patients, to malign our oath, then we shouldn't be doctors. We need to stand up and be true to our oath, be true to our patients. We need to stop concentrating on anything that is not that. And our cultural responsibility to stand up strong against the forces that would have us contaminated. That's probably the most important thing we do. And it takes a certain amount of self-sacrifice. Can the profession survive in America, the profession of medicine? If you're talking about economics and capitalism and the way the fiscal and financial pressures of our system make it difficult to not focus on profit and money, when you talk about that, what you frequently forget is that the profession of medicine is about healing. It's not about CAT scans or the profit from a mammogram or the profit from handing out a pill. It's about the healing. So the profession of medicine could survive and prosper if every single piece of technology dissolved tomorrow. The actual profession of medicine could do very well. Hippocrates did very, very well. And people who treat the poor do fine. They may not be Donald Trump, but they do fine. Little community doctors who take trade and take small payments make a very good living, a perfectly adequate living for their services. So you could take away all the science and all the technology you wanted, and we would do fine as a profession. However, the profit that is now a part of American medicine is largely based on profit from products and pills and procedures. And if we didn't focus on those, then the money that would go away would not be the money that mattered, because it wouldn't be the money that was the healing money in most cases. It wouldn't be the money that was actually involved in the interaction that made a patient satisfied and brought them wellness and health. If you're talking about capitalism, economics, and financial pressures in America, the first thing to focus on is the patient and the doctor. And in that interaction, we're never going to lose money, we're never going to be poor and destitute in the field of medicine. One of the ways that we can transform American medicine, which per capita right now is about twice as expensive as the average of every other industrialized nation, with poorer outcomes in general, one of the ways that we can make ourselves more streamlined and efficient is to stop focusing on profit. If profit stops being the focus and health and wellness start being the focus, then profit, which is essentially money, which is essentially transactions of money, when transactions of money are the focus, then what happens? Costs spiral upwards, because what we focus on is things that transact money instead of things that transact wellness. And when you focus on things that transact money, guess what you get? The most expensive system in the world. That's what we have. When we start to focus on health and wellness, not only will our patients be happier and our physicians happier, but we'll spend a whole lot less money on CAT scans and pills and procedures, all of which are unnecessary and in many cases dangerous.